If you're an older man and you practice self-pleasure, I need to ask you something important. Have you ever wondered if it's truly healthy after the age of 50 or 60? Or perhaps you've worried in private that you might be causing some kind of invisible harm to your body? If so, you are far from alone in these concerns. This is a topic surrounded by confusion, outdated myths, and a distinct lack of clear, reliable information tailored for mature men. This remains one of the most common yet unspoken concerns for men in their mature years. After looking at the available medical data and research, it's easy to understand why there's so much uncertainty and conflicting information. If you're watching this video, hit that subscribe button right now. We share evidence-based health strategies specifically for men over 60 every single week. Also, drop a comment below telling us which country you're watching from. We love seeing our global community grow. Studies show that while a majority of men over 60 continue to practice self-pleasure regularly, many are doing so in the dark, unsure of the real effects on their hormones, their prostate health, or even their performance with a partner. The silence around this topic leaves men without the information they need to make informed decisions about their sexual health. Research published in the Journal of Sexual Medicine found that approximately 60% of men between ages 60 and 70 report masturbating at least monthly, yet most have never discussed this with their doctors or received any guidance about healthy practices. That's why today we're going to have an honest, science-based conversation without judgment or shame. I'm going to walk you through 10 surprising benefits of self-pleasure in maturity, and then crucially, 10 potential risks you need to be aware of, and to ensure your practice is a healthy one that supports rather than undermines your well-being. Let me share Gerald's story. Gerald is a 67-year-old retired engineer from Manchester, England. After his wife passed away 4 years ago, Gerald felt confused about his continued sexual desires and whether self-pleasure was appropriate or healthy at his age. He carried guilt from his religious upbringing, but also noticed that when he did engage in self-pleasure, he felt physically and emotionally better. Gerald researched extensively and discovered that not only was his practice healthy, but it was actually providing significant benefits for his prostate health, stress management, and sleep quality. Today, Gerald views self-pleasure as an important part of his self-care routine, no different than exercise or proper nutrition. He wishes he'd had access to clear, shame-free information decades earlier. Gerald's story represents millions of men who benefit from understanding the science rather than relying on myths and shame. Let's start with the good news, the evidence-based benefits that research has documented. First, it maintains penile health and tissue function. The act of achieving an erection increases blood flow into the spongy tissues of the penis, known as the corpora cavernosa. Think of it as a form of physical therapy for your sexual organs. This regular exercise helps maintain tissue elasticity, which is crucial for achieving and sustaining firm erections as you age. Without regular blood flow, these tissues can become less flexible and responsive. Research published in the American Journal of Medicine found that men who maintained regular sexual activity, including self-pleasure, had better erectile function than men who were sexually inactive for extended periods. The principle is simple. Use it or lose it applies to sexual function just as it does to muscles and joints. The erectile tissue requires regular oxygenated blood flow to remain healthy and functional. Second, it promotes prostate health and may reduce cancer risks significantly. This is perhaps the most significant benefit backed by substantial research. Multiple large-scale studies, including a landmark one from Harvard University that followed over 30,000 men for 18 years, have linked higher ejaculation frequency with a significantly lower risk of developing prostate cancer. The study, published in the journal European Urology, found that men who ejaculated 21 or more times per month had approximately 20% lower risk of prostate cancer, compared to men who ejaculated only 4 to 7 times monthly. This protective effect was strongest for the most aggressive and dangerous forms of prostate cancer. The theory is that regular ejaculation helps flush out potentially harmful substances, carcinogenic compounds, and inflammatory secretions from the prostate ducts, preventing the buildup of materials that could contribute to cellular mutations and cancer development. Additional research from Australia published in BJU International found similar protective effects across different populations and age groups. Third, it strengthens the pelvic floor muscles that are essential for multiple functions. The rhythmic contractions that occur during orgasm engage key pelvic floor muscles, including the pubococcygeus muscle, the bulbocavernosus muscle, and other supporting structures. A strong pelvic floor is vital for multiple aspects of men's health: erectile function by supporting blood flow restriction mechanisms, ejaculatory control by managing the timing of seminal emission and expulsion, bladder control, which becomes increasingly important with age, and preventing urinary incontinence, which becomes a common issue for aging men, affecting up to 30% of men over 70. Regular orgasms provide natural pelvic floor exercise that helps maintain the strength, coordination, and tone of these critical muscles. Physical therapists often recommend pelvic floor exercises for men dealing with incontinence or erectile issues, and orgasm provides this workout naturally and pleasurably. Fourth, it reduces the stress hormone cortisol and promotes deep relaxation. In our high-stress modern world, this is an incredible built-in benefit that shouldn't be overlooked. Research has shown that orgasm leads to a significant drop in cortisol levels, the primary stress hormone that chronically elevated can damage virtually every system in the body. Lower cortisol helps regulate blood pressure, reduce anxiety and worry, improve immune function by allowing immune cells to function optimally, support cardiovascular health by reducing inflammation in arterial walls, and even improve cognitive function and memory. This makes self-pleasure a natural tool for both mental and physical well-being. A study in biological psychology found that sexual activity significantly reduced stress-related blood pressure increases, with protective effects lasting for days after the activity. The stress buffering effects of sexual activity were more powerful than other relaxation techniques in head-to-head comparisons. Fifth, it releases a cocktail of beneficial neurochemicals that improve mood and well-being. Orgasm floods the brain with dopamine, the motivation and pleasure molecule that's essential for mood regulation, goal-directed behavior, and experiencing pleasure from life's activities, and oxytocin, often called the bonding hormone that promotes feelings of contentment, trust, and well-being, even in the absence of a partner. This natural mood boost provides a sense of emotional satisfaction and connection that's invaluable for mental health, particularly for men who may be isolated, grieving the loss of a spouse, or dealing with depression. Endorphins are also released in substantial quantities, providing natural pain relief that can ease chronic pain conditions and contributing to the sense of well-being and even mild euphoria that follows orgasm. For older men dealing with chronic pain from arthritis or other conditions, this natural analgesic effect can provide meaningful relief without the side effects and dependency risks of pain medications. Sixth, it aids in the self-detection of physical issues and abnormalities. The practice of self-pleasure makes you intimately familiar with your own anatomy, how things normally look, feel, and function. This regular self-examination is one of the most effective ways men discover early signs of conditions like testicular lumps that might indicate cancer, with early detection dramatically improving survival rates, penile fibrosis, or Peyronie's disease, which causes abnormal curvature and can be treated more effectively when caught early. Unusual discharge that might indicate infection, changes in erectile quality that could signal cardiovascular disease, or other anomalies that might otherwise go unnoticed until they become serious problems requiring more aggressive treatment. Early detection dramatically improves treatment outcomes for virtually all conditions, making this benefit potentially life-saving. Testicular cancer, for example, has a cure rate exceeding 95% when detected early, but outcomes worsen significantly with delayed detection. Seventh, it improves sleep quality significantly through natural hormonal mechanisms. After orgasm, the release of hormones like oxytocin and prolactin, combined with the reduction in cortisol and the physical relaxation that follows muscular tension and release, creates a powerful natural sedative effect. This helps the body and mind relax deeply, making it easier to fall into restorative deep sleep, something that often becomes more challenging with age as sleep architecture changes. Many older men struggle with insomnia, frequent nighttime waking, or poor sleep quality. Using self-pleasure as a natural sleep aid is far healthier than relying on sleeping pills like benzodiazepines or Z-drugs with their numerous side effects, including next-day grogginess, cognitive impairment, dependency risks, and increased fall risk in older adults. Research published in Frontiers in Public Health found that people who engaged in sexual activity before sleep reported better sleep quality and felt more rested upon waking compared to nights without sexual activity. Eighth, it enhances overall pelvic blood circulation beyond just erectile tissue. Masturbation improves blood flow throughout the entire pelvic region, not just the penis. This increased circulation is beneficial for the health of the bladder, helping prevent urinary tract infections and maintaining healthy bladder function. The prostate gland, delivering nutrients and removing waste products, and the surrounding musculature, preventing the stiffness and dysfunction that comes with poor circulation. Good circulation is fundamental to tissue health and function throughout the body, and the pelvic region is no exception. Poor pelvic circulation contributes to numerous problems including erectile dysfunction, prostate enlargement, bladder dysfunction, and pelvic pain syndromes. Regular sexual activity maintains healthy circulation patterns. Ninth, it can serve as a training method for improving ejaculatory control. For men who struggle with premature ejaculation, which can become more common with age, after periods of sexual inactivity or due to performance anxiety, masturbation provides a safe, private space to practice control techniques. The stop-start method involves stimulating yourself to high arousal, then stopping all stimulation until arousal decreases, then resuming. The squeeze technique involves applying pressure to the glands when approaching orgasm to reduce arousal. These techniques allow you to better understand your body's arousal signals, recognize the point of ejaculatory inevitability, and build greater conscious control over the ejaculatory reflex. These skills can then translate to partnered sex and improve sexual satisfaction for both you and your partner. Sex therapists routinely recommend these solo practices as part of treatment for ejaculatory concerns. And 10th, it keeps your sexual desire and neural pathways active and responsive. The brain is truly the largest and most important sex organ in the human body. Sexual response begins in the brain with desire, fantasy, and arousal before any physical response occurs. By regularly engaging in sexual fantasy and physical stimulation, you are keeping the neural circuits associated with desire, arousal, pleasure, and orgasm firing and maintaining their strength and sensitivity. This helps maintain a healthy libido and sexual responsiveness, even if you don't currently have a regular partner or are between relationships. Sexual function, like other brain functions, including memory and problem solving, benefits from regular use and deteriorates with prolonged inactivity. Men who remain sexually active in some form maintain better sexual function into their 70s and 80s compared to men who become completely sexually inactive. But to have a complete and honest picture, we cannot just focus on the positives. A healthy practice is a conscious, informed practice based on understanding both benefits and risks. So now let's talk about the 10 potential risks or negative effects that you need to watch out for and manage appropriately. Understanding these risks allows you to practice self-pleasure in a way that maximizes benefits while minimizing potential harm. Most of these risks can be completely avoided with awareness and appropriate adjustments to your practice. The first risk is social isolation and relationship avoidance. This becomes a genuine problem when self-pleasure stops being one part of a healthy sexual life and instead becomes a substitute for real human connection and intimacy. If you find yourself consistently choosing masturbation over opportunities for real relationships or intimate connection with a partner, this is a warning sign worth examining. Some men, particularly after divorce or widowhood, retreat into self-pleasure as a safer, easier option that avoids the vulnerability and potential rejection of dating or new relationships. The solution here is honest self-awareness and perhaps conversations with a therapist. Ensure this practice is complementing your life and supporting your well-being, not allowing you to withdraw from meaningful relationships and social engagement that are essential for emotional health and longevity. Second is the risk of skin microlesions and tissue damage from improper technique. This typically happens when masturbation is performed too aggressively, too frequently without adequate recovery time, or without adequate lubrication. These tiny tears in the delicate penile skin can cause irritation, redness, inflammation, pain, and can even become entry points for bacterial infection, leading to cellulitis or other complications. Some men develop a condition called traumatic masturbatory syndrome from years of excessively aggressive technique, often involving pressure or friction against surfaces rather than using hands. This can result in difficulty achieving orgasm through normal stimulation. The fix is straightforward. Always be gentle with yourself. Use a quality water-based lubricant which reduces friction dramatically, and if you notice any pain, redness, swelling, or irritation, give yourself complete time to heal before resuming activity. Prevention is always easier than treating tissue damage. Third is desensitization to normal stimulation levels, a neurological adaptation. If you stimulate yourself in the exact same way with the same pressure, speed, grip tightness, and rhythm every single time for months or years, your nervous system can become conditioned to respond only to that very specific touch pattern and intensity level. This neurological adaptation, sometimes called death grip syndrome when it involves very tight gripping, can make it difficult or impossible to achieve arousal or orgasm with a partner whose touch is naturally different, softer, and more varied. The brain essentially becomes wired to respond to one specific pattern. The key to preventing this is consciously varying your technique, your rhythm, your grip pressure from firm to light, your speed from slow to fast, and your mental focus during self-pleasure to maintain broad sensitivity and responsiveness to diverse types of stimulation. Using lubricants also helps maintain sensitivity by allowing lighter touch to be effective. Fourth, it can mask underlying causes of erectile dysfunction that need medical attention. If you can achieve firm erections easily during masturbation, but struggle significantly with a partner, experiencing soft erections or complete inability to achieve erection, it might be tempting to ignore this discrepancy and assume everything is fine since you can still function alone. However, this pattern can indicate and mask serious underlying health problems like cardiovascular disease with arterial blockages, diabetes causing nerve and blood vessel damage, hormonal imbalances including low testosterone or thyroid problems, or psychological issues like performance anxiety or depression that need professional attention. Masturbation occurs in a low-pressure, familiar environment, while partnered sex involves performance pressure that can reveal underlying problems. If you notice this consistent pattern, it's essential to consult a doctor for proper cardiovascular, hormonal, and psychological evaluation, rather than ignoring warning signs your body is sending about potentially serious health conditions. Fifth is nerve compression from poor posture during the activity. Many men masturbate while sitting in hard chairs, hunched over laptops viewing pornography, or in other positions that compress the pudendal nerve that runs through the pelvis and supplies sensation to the genitals and motor control to pelvic muscles. Over time, chronic compression can lead to numbness in the genital area, burning or tingling sensations, pelvic pain syndromes, or even erectile difficulties from nerve damage. Pudendal nerve entrapment is a recognized medical condition often caused by prolonged sitting or cycling, but can also result from poor positioning during sexual activity. The solution is practicing in relaxed, comfortable positions like lying down with proper support and varying positions to avoid repetitive strain on any particular nerve pathway. If you experience persistent numbness or pain, consult a doctor as physical therapy can help restore nerve function if addressed early. Sixth, it can become an unhealthy emotional escape mechanism or coping strategy, replacing healthier approaches. Using masturbation as your only or primary tool to cope with difficult emotions like stress, anxiety, boredom, loneliness, grief, or frustration can create a behavioral dependency similar to other compulsive behaviors like overeating or substance use. While occasional use for stress relief is perfectly healthy and beneficial, relying on it exclusively prevents you from developing more effective and sustainable coping strategies. It's crucial to have a diverse toolkit for managing your emotions, including physical exercise, which provides similar neurochemical benefits, meditation or mindfulness practices, social connection and meaningful conversation, creative pursuits that provide flow states, and professional counseling when needed to work through difficult life transitions or trauma. Seventh is persistent feelings of guilt and shame rooted in cultural or religious messaging. Many men, particularly those raised with strict cultural or religious taboos about sexuality and self-pleasure, carry deep shame about this natural practice well into their later years, despite intellectual understanding that it's normal and healthy. If these feelings persist and cause you significant distress, anxiety, intrusive thoughts, or impact your self-worth and self-esteem, it can be incredibly beneficial to speak with a sex-positive therapist or counselor who can help you reframe this natural biological function in a healthier, more balanced light and resolve conflicts between your deeply held beliefs and your natural biological urges. Many men find that addressing this shame transforms not just their sexual health, but their overall emotional well-being and self-acceptance. Eighth is pelvic congestion from excessive frequency without adequate recovery. While infrequent ejaculation carries risks for prostate health, as we discussed, excessively frequent ejaculation, meaning multiple times daily over extended periods, can sometimes lead to a feeling of heaviness, dull aching in the testicles and pelvic area, temporary erectile difficulties, or diminished pleasure response. This occurs because the tissues and glands involved need adequate recovery time between sessions to replenish seminal fluids and recover from the muscular contractions involved. The solution is moderation and listening carefully to your body's signals. If you experience discomfort, diminished pleasure, or difficulty achieving erection or orgasm, these are signs you're exceeding your body's comfortable frequency. Reduce frequency and allow proper recovery time. There's no universal right frequency as it varies by individual biology and age. Ninth is potential temporary impact on semen quality if conception is a goal. This is only a concern if you and a partner are actively trying to conceive a child, which is less common but not impossible for men in their 60s with younger partners. While masturbation doesn't harm your long-term fertility or sperm production capability, ejaculating daily or multiple times daily can temporarily reduce sperm concentration and motility in any given ejaculation because production and maturation take time. For optimal semen quality when conception is the goal, research suggests an abstinence period of 2 to 5 days produces the best balance of sperm quantity, quality, motility, and DNA integrity. However, abstinence beyond 5 to 7 days doesn't improve quality further and may actually decrease it. And 10th, disconnection from reality, often linked to pornography use and escalation. If your masturbation practice becomes heavily reliant on extreme, unrealistic, or progressively more intense pornography, it can significantly skew your expectations about sex, what bodies should look like, what partners should do, and what intensity of stimulation should be required for arousal in ways that make it difficult to connect authentically with a real-life partner with a real body and real responses. The dopamine-driven escalation that often occurs with internet pornography use, where users progressively seek more novel or extreme content to achieve the same arousal level, can also lead to difficulty achieving arousal without increasingly intense visual stimulation. This can create a disconnect where real intimate experiences feel boring or insufficient. The key is maintaining balance, limiting or eliminating pornography use, using your own imagination and memories of real intimate experiences, and being mindful of how visual content might be affecting your expectations, arousal patterns, and responses in real situations. So, as you can clearly see from this comprehensive overview, self-pleasure after 60 isn't simply good or bad, healthy or unhealthy. It is a tool, a natural biological function with significant potential benefits and some risks that need conscious management. Like any tool, how you use it, how frequently, with what mental framing, and with what awareness determines whether its effects on your life are positive or negative. The secret ingredient that determines outcomes is always consciousness and moderation, practiced with self-awareness, respect for your body's signals, appropriate frequency that feels right for your individual body, healthy mental framing free from shame, and balanced integration into a full life that includes social connection. It can be a powerful ally for your physical health, mental well-being, and continued vitality throughout your later years. Let's return to Gerald's story. After educating himself, Gerald implemented a balanced approach. He practices self-pleasure 2 to 3 times weekly, which feels right for his body and provides the prostate health benefits he was seeking. He uses quality lubricant to prevent any tissue irritation. He varies his technique to maintain sensitivity. He focuses on his own physical sensations and positive memories rather than relying on pornography. He views this practice as one component of his self-care, alongside his daily walks, healthy diet, and social activities with friends. Gerald reports better sleep, reduced stress, and peace of mind knowing he's supporting his prostate health. Most importantly, he's released the shame that burdened him for decades. Gerald's balanced, informed approach represents the ideal we're discussing. I genuinely hope this conversation was helpful and provided clarity on a topic that's often shrouded in confusion and shame. What was the most surprising or valuable point for you today? What questions do you still have? Leave a comment below. Let's continue this important discussion together and support each other in making informed decisions about our health. If you found value in this video, please give it a like and subscribe for more straightforward, well-researched advice on men's health after 60. Hit that notification bell so you won't miss future conversations on topics that matter to your health and quality of life. Thank you for watching Men's Health 365. We'll see you in the next video with more evidence-based strategies for men over 60.